Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to local anesthesia. Before going to explanation, if you want to watch the same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch that video. But if you want to watch in English language, then this video is for you. Now today topic is local anesthesia. In today's topic, we will study three major headings. First is definition of local anesthesia. Second is methods of inducing local anesthesia. Third is desirable properties of local anesthetics. First, we start from definition of local anesthesia. What is local anesthesia? Basically, local anesthesia is loss of sensation in a specific area due to two causes. Number one cause is depression of excitation in nerve ending. The second cause is inhibition of conduction of impulse in peripheral nerves. These are the two causes of loss of sensation in a specific area. Loss of sensation in a circumscribed area means specific area of body caused by depression of excitation in nerve ending or inhibition of conduction process in peripheral nerves. These are the two causes of loss of sensation in a specific area of body. This is the definition of local anesthesia. Now come to methods of inducing local anesthesia. Now there are 6 methods for inducing local anesthesia, mean to produce loss of sensation in a specific area of body. Number 1 method is compression of tissue or mechanical trauma. Now, how due to compression of tissue or mechanical trauma loss of sensation occur? When mechanical trauma occur, on trauma site there will be bleeding, and when bleeding occur, the blood supply of the neuron become affected. When the blood supply of neuron affected, the oxygen supply of the neuron become affected. In result, due to blood supply, due to decreased blood supply, due to decreased oxygen supply, the function of the neuron become altered, mean the excitation of neuron become altered, the conduction of neuron become altered. In result, there will be loss of sensation. Second method is low temperature. Again, the mechanism is same. In low temperature, the blood supply of neuron become decreased. Due to the function of neuron become altered. In result, there will be loss of sensation. The third method to induce the local anesthesia is anoxia. What is anoxia? Severe hypoxia is called anoxia. Mean severe decrease of oxygen supply to the neuron. When severe oxygen supply, decrease oxygen supply to the neuron, in the result, again the neuron function become altered. In the result, there will be loss of sensation. Now, why anoxia occur? Why severe hypoxia occur? Again, due to affected blood supply. When there will be decreased blood supply to the neuron, again there will be, in the result there will be decreased oxygen supply. In the result, there will be severe hypoxia, and in the result there will be loss of sensation, and the local anesthesia effect will be induced. The fourth method is chemical irritant. Now, in chemical irritant like eugenol, when tooth pain occurs, when we place the eugenol inside the cavity, in the result, the pain become decreased. In the result, the pain become finished. Why the pain become finished? Again, due to loss of sensation. Due to loss of sensation, due to alter the conduction of nerve impulse. Fifth is the neurolytic agent like alcohol, phenol. Now, what alcohol do? Alcohol decrease the neuron activity, the axon conduction. In the result, there will be loss of sensation. The sixth method of inducing local anesthesia is chemical agent like local anesthetics. These are the 6 methods of inducing local anesthesia, mean inducing loss of sensation effect. Now, the question is that are we use all the 6 methods in wards in clinics? No, we do not use all the methods in clinic because there are 2 criteria for methods to use in a clinic, to use in a ward. The first criteria, the agent we use for local anesthetic effect. The first criteria for fulfillment of the agent is the agent should be reversible. The effect of agent should be reversible. Second, the effect produced by agent should not be permanent. Like when we use alcohol, it permanently changes the function of neuron. The agent when we use in clinic, in ward, fulfill 2 criteria. Number one criteria is it should not be permanent. Number 2, it should be reversible. The action of agent should be reversible, and this agent should not create permanent alteration in the neuron. Now, these 2 criteria is necessary for methods to use in clinic, in ward. Now, in these 6 methods, only chemical agent fulfill these 2 criteria. Therefore, we use only the chemical agent local anesthetics in the wards, in the clinic. The rest 5 methods do not fulfill these 2 criteria. Therefore, we do not use in the ward, we do not use in the clinics. These are the methods of inducing local anesthesia. Now come to the desirable properties of local anesthesia. The next heading is desirable properties of local anesthesia. Desirable properties mean the properties which we want from local anesthetics. There are 10 properties which we want from local anesthetics. These are our desirable properties. These are the desirable properties of local anesthetics. Therefore, we use the local anesthetics in the ward. The first property of local anesthetics, desirable properties, it should be not irritant. The local anesthetics should be not irritant to the tissue. Either we use topically on tissue, either we inject inside the tissue. The second desirable property is it should not cause permanent alteration. Mean it should not cause permanent alteration in neuron like alcohol. Third property, low systematic toxicity. Local anesthetic should have low systematic toxicity. Like when we inject local anesthetic, after some time it will reach to our body system like cardiovascular system. We cannot block to reach to system to our body system, but we decrease reach to our body system by vasoconstrictor, but at the end it will be reached to our body system. Now, when it reaches to our body system, it should be less toxic to our body system. This is the third desirable property of local anesthetic. Fourth, it should be effective. Local anesthetic should be effective. Either we use it topically, either we inject inside the tissue. It should be effective. It should not affect on mode of application. If we use topically, it creates effective effect. It creates loss of sensation. When we inject inside the tissue, it could not create effect. It should be regardless of method of application. It should be effective. If we use topically, it should be effective if we inject inside the tissue. The fifth desirable property is time of onset should be short. The time of onset, the time of initiation of effect should be short. Sixth desirable property is duration of action should be enough. It should provide enough duration of action in order to we do a procedure. If duration of action is short, then between the procedure the patient feel pain. And duration of action should not be more prolonged, then we will be wait for hours. It should be enough. The seventh desirable property should be potent. It should be potent. Potent means it should be create effect in very small amount. If it is not potent, when we use a small amount, then we increase the dose. At the end, due to more increase of dose, in the result there will be toxicity. The eighth effect, it should free from allergic reaction. It should not produce allergic reaction in our body. It should be free from allergic reaction. The ninth effect should be stable in solution. It should be stable in solution like oral fluids, saliva. The 10th effect should be sterile. It should be sterile, mean it should be sterilizable. When under the heat we sterilize the solution under the heat, its structure, its composition, its structure should not be deteriorate. These are the 10 desirable properties of local anesthetic which we want from local anesthetic. It should have these 10 desirable properties. Now today we studied definition of local anesthesia, methods of inducing local anesthesia, and desirable properties of local anesthetics. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon to open all notification in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.